Thank you, Chair and members of the committee. Thank you for this opportunity to speak. My name is Dr. Jared Ross. I'm a board-certified physician and a senior fellow at Do No Harm Action, an organization that works to prevent discrimination in the provision and delivery of healthcare, as well as to protect children from harmful medical interventions. I'm providing testimony today in opposition to SB 1380. While I applaud the intent of SB 1380 to prohibit discrimination by healthcare providers, I'm concerned that the bill could be misused to compel doctors to provide dangerous medications or procedures to children suffering from gender dysphoria. We know that most, if not all, children dealing with gender distress have underlying health and mental health challenges. This includes depression, anxiety, eating disorder, autism spectrum disorder, or a history of physical or sexual abuse. While these children most certainly need compassionate talk therapy and possibly psychiatric medical care to address these challenges, we must protect them from the horrors of so-called gender-affirming care. Let's be clear, there is no strong evidence to support the use of medical interventions such as puberty blockers, cross-sex hormones, or surgical procedures to treat gender-distressed children. The more light we shed on this topic, the more we expose the lack of evidence supporting these procedures and the less defensible they become. The Cass Review, an exhaustive study of gender services for minors in the United Kingdom, found that the evidence supporting these treatments was very weak. Additional systematic reviews conducted by the health authorities in Finland, Sweden, and the state of Florida have come to the same conclusion. Moreover, several of the most often cited studies used to support the gender affirmation approach are rife with methodological flaws. In response to this paucity of evidence, multiple countries in Europe and South America have restricted minors' access to gender medical interventions. And while many claim that puberty blockers are reversible, the use of puberty blockers have been shown to cause decreased bone density and lasting effects on brain development, impairing learning, spatial memory, social behavior, and emotional processing. These irreversible procedures do nothing to address the underlying issues that these vulnerable children are facing. And several large studies in adults, including one released earlier this week, show worsening mental health outcomes after these procedures. We must ensure that children suffering from disabilities are not used as a pawn to promote an ideologic.
Thanks, sir. Your time has elapsed. Let's see if there are questions for you. Comment or question from members of the committee. Rep. O'Day.
Thank you very much, Mr. Chair. Thank you, Doctor, for your testimony. I was looking for it online. Did you submit any online?
Representative, I didn't submit it online, but I am more than happy to do that.
Please, I beg of you to please submit it online. It sounded like you're almost finishing up. What were you staying there towards the end? I missed it.
Thank you, Representative. I was saying that we must ensure that these children who are suffering from disabilities are not used as pawns to promote an ideological anti-scientific agenda under the guise of preventing discrimination.
Sorry, what was the study that you made reference to, the most recent study? I think you said there was a recent study, and I didn't hear it. If you said it, I apologize.
There was a recent study published earlier this week, and I will be happy to submit that along with my written testimony. I also cited the Cass Review, an exhaustive study that was performed by Dr. Hilary Cass in the United Kingdom. It's an over 400-page study that summarized multiple studies that have been done across the world.
Thank you. I appreciate that. I definitely want to look at the studies. I have the same concerns that you do, but I'm not a doctor. So whatever studies you can provide us with, I promise you I will read. Thank you very much. Thank you.